by HIV. Ensuring that no one is left behind, it is a call to action to build a world where human rights, access to care, and social justice are the foundation of the HIV response. The Kenya theme, promoting the health and well-being of men and boys, serves as a reminder of population being left behind in the response of HIV. NEFAC acknowledges with deep regret the Ministry of Health reports of the high and rising cases of advanced HIV disease among men, and we fully support the call for Race Against Time to fill the men and boys. This because of the low uptake and utilization of health and HIV services by boys and men. We must remember that HIV is not just a biomedical issue. It is a matter of rights, equality, and access to essential service. Taking the right path means empowering men and boys to access quality health care, education, and service system that protect their dignity and well-being. It is also means tracking HIV-related stigma and discrimination that hinder men from accessing health services. Yes, real progress has been made in the response to HIV. However, AIDS is not over, and we must therefore make deliberate efforts to ensure that the response of HIV is anchored in the universal health coverage and primary health care drives with why HIV management cannot be part of the social health insurance shift. And when the chronic illness fund, in our opinion, HIV-infected children need to be prioritized under the emergency and critical illnesses fund. This is the only way to sustain the response of HIV in Kenya. Sustaining the response calls for increased HIV fundraising from both the national and county government to end AIDS. The county needs predictable and sustainable supplies and commodities to prevent, treat, and provide care to HIV. We therefore call upon the county government to increase the direct allocation to HIV, to put the county back to track to deliver on the 95-95-95 target and put Kenya in the path to end HIV and AIDS as public health threat by 2030. Thank you very much.
Thank you. Now I invite CSO Network representative, Madam Leon.
To our chief guest, the governor, county government of Homa Bay, distinguished guests, our partners, national government present, county government staffs, our young ones who want to graduate today, good afternoon. I am Aching Leon. I'm the Homa Bay County Civil Society Organizations Network Secretary General. It is my pleasure to be before you to commemorate this day, World AIDS Day. This falls within the 16 days of activism against gender-based violence. Thank you so much, the county government, for offering our partners the environment for prioritizing HIV control, treatment, and care. And therefore, that is why we even have 45 children that will be graduating, the AIDS children. Thank you very much to our partners for facilitating Homa Bay County, for supporting all these interventions so that we control HIV/AIDS. Without much ado, allow me request all the non-state actors among us to rise, because in the interest of time, we won't all come here. All the CSOs network members, kindly rise so that the delegates see you. They are among the participants. We only have one request, Your Excellency. Through the Chair, Health County Assembly, we've noticed this dwindling of donor funding and Homa Bay County in the fight of triple threat. We really request that we try to strike a balance so that Homa Bay County government can push and also prioritize, factoring in allocation of more budgets towards treatment, care, and control of HIV/AIDS. Thank you very much.
Thank you, Leon, for that wonderful request. And finally, I would like to invite Dr. Michael Audo on behalf of implementing partners. And also we will later invite Dr. Oliech from CDC. Karibu, Dr. Audo. Yeah,
okay. Her Excellency the Governor, all protocols observed. I'm here before you, and we are glad to be part of this congregation. I'm called Michael Audo. I work with the LVCT Health, and we support this county for the HIV fight. And just to take us back, Her Excellency, I was born many years ago, and that time there was no AIDS. But this scourge moved so fast. By the time I was in high school, that's 1984, the first case was reported. By the time I was finishing medical school, HIV was already a national disaster. So that was a very short lifespan of the disease. And at that time, people were really dying. There were no tests for HIV. We used to send specimen to Nairobi. It takes a month to come back. There were no drugs, and people were actually dying. But we are glad that with the science and technology, now we are able to test real time, and we are able to offer lifelong treatment for HIV, and people living healthy. I'm told we are now talking of 95 to end this scourge, and that is to achieve epidemic control. Epidemic control we achieve when we have less people getting new infections than those dying. And with the statistics which has just been released, Homa Bay County in 2024 lost about 104,000. 1014 people died from HIV-related illness. And we had around 900 new infections. And that means we are actually achieving epidemic control. So I think we really need to thank all of us for the efforts which have been put, the county government, the partners. We are heading there, but still a lot of work to be done. We have heard of the triple threat. Our young girls are still under threat of new infections, GBV, and teenage pregnancy. We are just going back on our PMTCT achievements. By last year, such a time, we were at EMTCT rate of 5.3%. And this year, we are told we are sliding back. We are at 7.9%. And I think that one should make us walk in shame. We are letting down our children. At this time and age, we should not be having children born with HIV, yet we have all the drugs, we have all the information, and we have people who can do this for us. And I'm saying we need to tap into the CHP Community Health Systems Network so that we can reach all our mothers who are exposed and our babies born without HIV. As LVCT Health, we are committed to work with hand in hand with the county to fight this disease. We will continue supporting the county teams in capacity building, laboratory logistics, and of course, we are now talking of transition, and we are working hand in hand with the county to build the capacity of the county to be able to manage HIV program. Otherwise, we want to say thank you for the support we have gotten so far from the county government to allow us work in this county without any problems. And we hope we'll continue as we walk towards epidemic control. Thank you very much, and God bless.
Thank you, Dr. Udo. I now hand over the program to Chief Officer Public Health, Evelyn Ododa.
Thank you so much, Your Excellency, distinguished guests, ladies and gentlemen. Good morning. Good morning once more. It's a race against time. It's a race against time. World AIDS Day. Let's unite to end AIDS by 2030. So, Your Excellency, we gather here today to mark World AIDS Day, a day that we are creating awareness, a day that we are remembering the loved ones that we lost through HIV, a day that we are reconfirming our commitment to end HIV by 2030. So, today's theme, it's a race against time, reminds us of the importance of uniting together as stakeholders to end HIV/AIDS by 2030. Your Excellency, allow me to appreciate the stakeholders, including the CHPs, the healthcare workers, the CSO network, CDC, for the continuous support they've been offering to this county of endless potential in ensuring we achieve epidemic control against HIV. We say thank you and thank you so much. Allow me again, Your Excellency, to appreciate you for taking lead as a champion against triple threats in Western and Nyanza region. This one really shows a true leader. The only woman governor in Western Kenya, a woman that has the young ones at heart. We really appreciate you, Your Excellency, for these endless efforts you put in this county of endless potential. Asante Mama for the good work you are doing to enable us achieve our goals as a county. So, Your Excellency, without so much ado, allow me to just introduce the county staffs. I will start with the CHPs. So please just stand up. Nyamrerua kuma intiere chungmale mundo governor uneni nine intiere ka. Just wave to our Excellency. And we really appreciate the effort and the works you are doing at the community level. Thank you so much. Allow me again to introduce the sub-county HMT team. The ones who also help us in spearheading the planning for this day that we are commemorating today. Sub-county health management team, wherever you are, please just stand up and wave. Thank you so much. Allow me again, Your Excellency, to introduce the county health management team. Wherever you are, please just stand up and wave. Asanteni sana for the good work you are doing. Allow me again, Your Excellency, to introduce the county directors. Please, directors, wherever you are, for the interest of time, just stand up and wave. The county administrators, asanteni sana. Again, allow me to introduce the chief officers from different departments. We have Chief Officer Madam Dolphin from the Department of Gender. Asante sana for coming. Chief Officer Madam Diana from Department of Education. We appreciate you so much and feel most welcome in this meeting. So, Your Excellency, without so much ado, allow me introduce the CDC representative for Just Award. Karibu CDC team. And we really thank you for your support. Asanteni sana.
To our chief guest, Your Excellency Gladys Wanga, Governor Homa Bay County, CECs, chief officers, directors, officials from the health department and healthcare workers, US government supported partners, supported by CDC, USAID, DOD, Peace Corps and Peace Corps volunteers. Probably you could stand and wave. We also have MSF. My name is Julius Oliech from CDC Kenya. Ladies and gentlemen, good afternoon. It is an honor to be here as we gather to mark World AIDS Day and to celebrate a significant milestone in our collective efforts to improve public health in Kenya. As we stand here, we are reminded of the ongoing burden of TB and HIV, two intertwined epidemics that continue to claim lives globally. TB remains a leading cause of death among people living with HIV, and here in Kenya, particularly in counties such as Homa Bay, the dual burden of HIV and TB are significant. This underscores the need for innovative approaches to improve health outcomes and to save lives. Today, the governor has launched the ultra-portable digital chest X-ray machine with computer-aided diagnosis. This is a vital tool that will strengthen tuberculosis case finding in Homa Bay County. This achievement has been possible through the partnership between CDC Kenya and LVCT Health, with support from the county government of Homa Bay County and the dedicated efforts of healthcare workers in this community. Why is this launch important? The ultra-portable digital X-ray with computer-aided diagnosis is more than just a piece of equipment. It represents a transformative approach to TB diagnosis. Some of the benefits include enhanced detection of TB cases. According to the World Health Organization, TB is often undiagnosed, especially among people living with HIV that may exhibit TB symptoms. Computer-aided diagnosis has proven to be a game changer in this regard. WHO recognizes CAD as an effective tool to TB screening, increasing TB detection rates up to 40% in some high-burden regions such as Homa Bay County. Timely diagnosis and treatment with CAD chest X-ray can be analyzed instantly, allowing healthcare workers to identify suspected TB cases and initiate treatment promptly. Early diagnosis reduces TB transmission and improves patient outcomes. Reaching undeserved community. The ultra-portable design of the machine means that it can be deployed to remote and hard-to-reach areas of Homa Bay County, where access to healthcare services is often limited. By bringing diagnostic services close to the people, we are addressing one of the biggest barriers to TB care, which is accessibility. Integration with HIV programs. In Kenya, TB and HIV programs are closely linked because of the high co-infection rates. This technology will allow us to integrate TB screening seamlessly into HIV care services, ensuring that individuals attend HIV clinics, are screened regularly for TB. This integrated approach is essential for reducing the burden of both diseases. Supporting for healthcare workers. The automated analysis provided by CAD reduces the reliance on specialized radiologists, whose availability is often limited in rural areas such as this. This technology empowers healthcare workers by providing them with accurate and reliable tools to make timely decisions, ultimately improving the quality of care. CDC's commitment to public health in Kenya. At CDC Kenya, our mission has always been to support initiatives that strengthen health systems, save lives, and promote equity in healthcare. CDC Kenya, through funding from the President's Emergency Plan for AIDS Relief, continue to support the county government of Homa Bay directly and through various implementing partners to provide quality services for people living with HIV and TB. Today's launch reflects that commitment in action. By funding this ultra-portable chest X-ray with CAD, we are investing in innovative solutions that address the unique challenges faced by counties like Homa Bay. This initiative is part of our broader efforts to support Kenya's fight against TB and HIV. Our work focuses on building sustainable systems, fostering partnerships, and equipping communities with the tools they need to improve healthcare outcomes. This launch is a testament of the power of collaboration with LVCT Health and the county government of Homa Bay playing critical roles by bringing the vision to life. Looking ahead, while this launch is a significant step forward, we know the journey does not end here. The success of this initiative will depend on our collective efforts to ensure this technology reaches those who need it the most. We must continue to invest in training healthcare workers, raising community awareness, and integrating this tool into our broader TB and HIV efforts. On this World AIDS Day, we reflect on the progress we made in combating HIV and TB. Let us also renew our commitment to the fight. Your Excellency, we recognize your efforts in the fight against HIV in Kenya by continuing to be a champion for not only our people living with HIV and healthcare workers in the various roles that we play, and we'll continue working with you to ensure that the people of Homa Bay get the required services. To the people of Homa Bay and to the partners who have made this launch possible, Thank you for your dedication and your hard work. Together, we are building a healthier, brighter future for all. Thank you.
Thank you so much. Wapi makofi ya CDC? Thank you so much. Your Excellency, allow me to introduce the County Commissioner representative for award. Karibu sana, Madam.
Thank you so much to the Governor for Homa Bay County, the county executive members present, the officials, county government officials, my colleagues, ACC and chiefs that are present, development partners, na wananchi wote, the CHPs. Good afternoon. Good afternoon again. My name is Maureen Wamalwa. I'm Assistant County Commissioner for Asego East Division, but I'm standing here today for our county boss, Mr. Moses Leland, the CC for Homa Bay County. And he could not be here, but he would wish to be here. But we are here to represent him, and he has sent his greetings and his message of goodwill to encourage you to continue in this fight against HIV/AIDS, and also encourages collaboration in every effort that we make to ensure that this population, it is not marginalized and it is something that can be well managed. Your Excellency, before I continue, I would like to Okay. Thank you. So now, as I was saying, today we are here together with my colleagues, and Your Excellency, I would like to introduce them just by way of standing and to show their presence. And I would like to start with the chiefs and assistant chiefs that are present. Kindly be upstanding. Salute to our governor. Thank you. And these are our staff that are very committed, especially at the grassroots level. And we really appreciate the work that they do in terms of sensitization and also prevention of scenarios that could easily lead to social ill in the community. I also want to recognize my colleagues, ACCs. Kindly be upstanding, those who are present. Thank you. These are all ACCs from Diwa sub-county, and we also Homa Bay and Mbita sub-counties. Thank you so much for being here. So in my brief remarks, I would like to say that on today's, as we mark this day, I would like to just encourage each and every one of you for the efforts that you're putting in to ensure that we have a better living, despite of the challenges that are there in terms of human resource, in terms of finances that are there. But we soldier on. We ensure that we have to do the right thing for that, so that the community benefit despite of the menace of HIV and AIDS. And another thing is the issue of triple threat. It is something that has always provided the scenarios to cause the discrimination of small women or young girls, and even the entire gender, boys and men. But this is something that as the national government, we are very committed to ensure that we curb it so that we have a better society. And as I conclude, today as we mark this day, we are also into the holidays, the Christmas holiday, the New Year's. And I must say that this is the time that there's a lot of issues that come up. And when you look at the incidences in terms of the security issues that can happen, these are issues that are surrounding GBV. So mine is to encourage my colleagues, chiefs, assistant chiefs, ensure that there is proper sensitization, ensure that in the areas that you man, in your area of jurisdiction, there is proper manning so that we don't have these incidences that in most cases we see that the people are being discriminated just because of the differences in the power imbalance that is there in the society. So my urge is that as we continue with this day, I want to remind everyone that each effort that you put to our development partners, we appreciate you. Each effort that you put in, it is very significant. It is highly appreciated to ensure that our society, despite the challenges that are there, the unique challenges that are there in Homa Bay County, will be able to overcome them. Otherwise, I thank you so much. Thank you for coming, and I'm glad to be here, to be part of this day. And I appreciate everyone, and I pray that as you continue, may you always remain commitment to this effort, and God bless you all. Thank you so much.
Thank you so much, Madam. Your Excellency, allow me to thank our stakeholders for their commitments, their compassion, and action. Let's continue to stand united in the fight against HIV/AIDS. So at this juncture, Your Excellency, allow me invite the CCM for Public Health and Medical Services, Honorable Roslyn Omolo. Wapi makofi ya waziri?
Thank you very much, Your Excellency, the representative of the County Commissioner, my colleagues, our development partners, all our partners present, my colleagues, the soldiers in this great journey, members of the county health team, not just the county health management team. I don't have a lot to say, Your Excellency. Yesterday when you spoke about the journey that we have had, that we have traveled. And one of the things that greatly bothers me and bothers you, and we've had these conversations with you as a county, with you and the lakefront counties, some of the counties that are most burdened by HIV and AIDS. Our biggest issue, Your Excellency, is transition. And I'd like to give a very small comparison. When we talk about transition and when we talk about dwindling donor finances, I normally say, as a country, we are behaving like a man who is married, but every day when his wife asks him what they are going to eat, he tells the wife, let's wait for our neighbor to come from the market, and then we will know what we are eating. It's a very responsible way for a man to live, but that's how we've lived as a country. And I think it is time that we stopped that. We are now very sad about the outcome of the American elections because we are all holding on to hope and hoping that that neighbor is not going to reduce his funding. Again, Your Excellency, it's a conversation we've had, and you asked me how long does an emergency last when we were marking PEPFAR at 20. And you asked that if this was an emergency, if AIDS was an emergency 20 years ago, how are we still treating it as an emergency? And I think one of the things that we have to come up with as a county, we have a transition plan, which LVCT, through the support of CDC, kindly helped us to develop. But I think we need to go to the next level. And I like what you are saying to the chairman of the CSO networks, that it's not about us. It's not about the county assembly. It's a much, much bigger problem, Your Excellency, that I hope that even as we walk this journey, you as the Vice Chair of the Health Committee of the Council of Governors, you will be able to get to a point where you are able to put your foot down and say, we must cost health services. The reason we're in this place is we don't know how much it costs to provide health services in Homa Bay as compared to, let's say, Kirinyaga or Nairobi, or where there's no malaria burden, where there's no HIV burden, and so on and so forth. So I think as we talk about the transition journey, as we talk about what we have achieved, we must talk about sustainability. And I am proud to serve in the steering committee of the Sustainability and Transition Committee of the national, at the national level. And we were supposed to come up with an operation plan as of yesterday. We have not done very well, but we are still working under the guidance of NSDCC and NASCOP, and we know that by March we'll have an operation plan. What I want to ask our people, let us continue with advocacy. We are getting to a point where even testing is now being targeted, more targeted using AI, so that we reduce and we only test those that we must test in an effort to reduce costs. So I want us to continue to be open, as we were, the conversations that we saw today. And one of the things that has helped us as a region, and especially Homa Bay, to reduce our numbers is we have talked about HIV very openly. We are open about taking antiretrovirals. When you travel with people who take these drugs, there's a word they like saying. In the evening, you see them looking for water and saying, Mia urandi lanacha. When you're open about something, it does not become a burden. And we like the fact that we are at that point. Your Excellency, part of our journey has been successful delivery of children who are born to both parents being positive, but these children have been born negative. And to commemorate this occasion, Your Excellency, we have a cake that we want you to help us cut. It's the last thing I want to request that you do as you go to make your speech. And then we will call a few of the mothers of the children who, we call them Hay graduates. Evelyn, if you could bring the cake now. Oh, okay. It's okay. Sorry. Thank you. I have been guided that Her Excellency will make her speech, and then after that she will cut the cake. With those few remarks, I want us all to be upstanding.
Thank you very much. Please be seated. I know the stadium usually has a challenge on how to stand. If you stand like this, you give those people your back. If you stand like this, you give those people your back. If you stand like this, you give these people your back. But I chose to give the fewer people my back and talk to the majority of the people. So really, to our partners, CDC, LVCT, and the many, many numerous partners that we have here today, our CC for Health, and our Chief Officer for Public Health and the County Health Management Team, our Ngao, led by our SCC for Asego East, and our chiefs, and our other SCCs, the CHPs here, the people of Homa Bay, hamjambo. Hamjambo. You know, they say Homa Bay people don't know Kiswahili. Hamjambo. Let's prove them wrong. Dawa ya moto ni? Akufae kwa dhiki ndiye? Ikare dongwange Kiswahili mangen. We know a lot of Kiswahili. For those who are doubting, so it's a race against time. We are racing against time to end AIDS by 2030. And that is part of the reason why we are here today, to remind ourselves that we want to end AIDS by 2030. And we were discussing with Rosalind and saying that when we started saying we want to end AIDS by 2030, we didn't know that 2030 would come. But now, 2030 is around the corner. Because now it's 2025, Sindio? Because 2024 is finished. It's 2025, then 2026. Then we don't count 2027 and part of 2028 because we will go for election and many things will be going on. Then now 2029 and then it is 2030. And by that time, we are hoping to end AIDS. And for us to end AIDS, Dr. Udo was saying, the people who are getting newly infected should be finished. Is that what we are saying? Huh? No, but if they're lower than those who are dying, will we have ended AIDS? But Dr. Udo said the people who are newly getting infected should be lower than those who are dying. Then we will be looking at where we are. So, we have made great progress since we began this effort 40 years ago. There has been a lot of work done by a lot of people. And as I stand here today as Governor of Homa Bay, and not just Governor of Homa Bay, I've worked in the HIV sector. I worked with LVCT Health for 5 years, nearly. CDC used to be our donors, and we used to panic when CDC was coming because we had to write our reports and make them perfect. But LVCT is a very, very good organization, a very, very good local NGO, and we did a lot of work while we worked there. I was hired by Dr. Tiso, who's currently the executive director of LVCT Health. So I speak about HIV not just from a point of being governor, but from a point of having worked in the sector, but like many, many of us, from a point of having personal experiences with HIV, people close to us and other people having walked this journey, knowing what has gone on in the past. So where we are, having made the progress that we have, we must consolidate the gains. And I think, Dr. Uda, as you were saying, we must be concerned about our PMTCT numbers. Yesterday, when I went to the studio to speak about our effort, I was planning to say that our PMTCT, our infection rate, mother to child, is 5.3%, because that's what I remember from last year. But I was given a rude shock that it's now 7.9. So I think in terms of looking at not slipping back, not backsliding, not losing any of the gains we've made, I think we must come together and re-strategize on how to make sure our numbers are constantly going lower, especially for us in Homa Bay and other counties around the Lake region that are disproportionately affected by HIV. I am very, very pleased that we are speaking about the health and well-being of men and boys, because for a long time we spoke about adolescent girls and left behind the men and boys, adolescent girls, women, and left behind men and boys. As Homa Bay County, I had begun when I was still an MP, a program to mentor our girls. But there was always the question of what about the boys? And we have, last year, for the first time, brought together over 5,000 boys for mentorship sessions. And I think it was very, very eye-opening. And even in this year, we will continue with our boys' mentorship sessions. But what I want to tell the partners, when we do the girls' mentorship, there are very, very many partners who are willing to support because it aligns with their programs. But when we are doing mentorship for boys, it has been a bit more difficult to bring together resources, because when, these are not adolescent girls, and a lot of programs are around adolescent girls. So I think we must open up that space. Our Chief Officer for Public Health said that I am the champion for the triple threat, not just in the region, but in the country. We want to deal decisively with the issue of adolescent pregnancies, sexual and gender-based violence, and new HIV infections. And this is something that we have come together, not just as myself, but as women leaders in this region, to advocate strongly with our parents, both fathers and mothers, with our girls, with our partners, with our CHPs, to see to it that we are not getting new adolescent pregnancies. We are very concerned that there is a 23% rate of adolescent pregnancies in Homa Bay. I think that's way too high. And it is also the same, it is similar, although slightly lower, in other counties in our region. So this Friday and this Thursday and Friday, we will be gathered as women leaders from across this region for a program called Siganinam, which we will be doing in Migori County, and we will be discussing the progress we have made so far and what other interventions can we do with our partners to ensure that we deal decisively with the issue of the triple threat. I want to speak a little about financing because it is the elephant in the room. Our partners who have stood with us and carried this burden of dealing with HIV and AIDS for the last 40 years, understandably, are cutting back on the levels of funding. Meanwhile, as was said by our CSO network, we are not necessarily seeing requisite increase in funding to cover for the gaps that are being left behind by this transition. It is a very, very big question. And what I'd like to say is, it's not just a question of counties, because health is devolved, yes, but you could say that counties should allocate more resources towards HIV and AIDS. But the reality of the matter is, one, the revenue sharing formula that we have does not take into account the fact that some counties have a disproportionately heavy burden of disease of HIV. You have people who are on treatment from the beginning to the end. And the revenue sharing formula by the Commission on Revenue Allocation does not take this into account. And we as the Lake Region Economic Bloc presented to the Commission on Revenue Allocation, when they're doing the new formula, they should allocate more resources to counties that are dealing with the HIV and AIDS pandemic. They should do it so that when the CSO network says, Governor Wanga, put more money, I have more money to put. But right now, even if I was told put more money, really, I have nowhere else to take the money to put. The other factor is, those of you who've been following the debates on revenue allocation at the national level will remember that at the beginning of this financial year, the National Assembly and the Senate had both passed an equitable share to county governments of 400 billion. After the Gen Z protests and the failure of the finance bill, even though the law is clear that in the event of revenue shortfalls, the national government should shoulder any deficits, not the county governments, even though that is very clear. The law was returned to the National Assembly and it was reduced from the 400 billion to 380 billion. And when the Senate insisted on 400, there was a mediation process. And the mediation came from 380 in the National Assembly, 400 in the Senate, to meet at 387 billion. What that means is counties are going to be getting less money than they should have gotten, which makes it very heavy. And what counties have said all the time is don't even get money from anywhere else. Just look at health as a devolved function. Look at the money that is being retained, the over 100 billion that is being retained in the health ministry in Nairobi, and take it and bring it to counties so that counties are able to resolve some of the issues that we are facing down here. Otherwise, it is going to be very difficult to have a devolved function with monies retained at the national level and counties expected to perform these services without the resources. Funds must follow functions. And that is the center principle of devolution. I want to thank the partners and our health team for the progress you have made in integration of services, so that today we are not dealing in silos of services, at least to a large extent. I think we must continue to strive to integrate services so that anybody walking into a facility does not have to be told, oh, are you HIV positive? That is your corner. Are you HIV negative? That is your corner. Because as we were saying, and as has been said by many of our speakers before me, we are living longer with HIV. We are dealing with other lifestyle ailments. We are dealing with non-communicable diseases. As I saw, MSF was showing us down there that they were also now screening us for other lifestyle diseases. So integration of service is paramount. Let me end by thanking very, very much CDC for the portable digital X-ray machines that you have given to us for purposes of the SENA in Fangano and as well as Ndiwa facilities. This will go a long way in improving the level of care and services that we provide to our people. While I was sitting here, Daktari just whispered to me that we might be fortunate that KCCB is also finding another X-ray machine. Remember we said add us another 2. Not that we are bad people, we are just saying, not that we are not satisfied. No, we are very grateful. It's just a level of need. So if you had something that was probably going to another county, no, not necessarily going to another county, just look for us 1 or 2 others and bring to us, we will really, really appreciate. But I really, really would like to appreciate that support. It is support at the right time, in the right places, for the service of our people. So as a county government, I would like to make our commitment that to the extent possible, we will allocate the necessary resources with support of the county assembly. The chairman was here. I just had to send him to deal with something else. But the county assembly is committed to funding HIV services across Homa Bay. And we hope that when we meet again next year, we will be, the race is against time, but we will be catching up with time so that by 2030, we will have reached the end of AIDS. Thank you so much. God bless you. And thank you all for making time to come and for your support. Asanteni sana.
Thank you very much, Your Excellency. Your Excellency, as demonstration of an actual